electronic health record systems is now getting popular as it can meet clinical and business needs in healthcare by capturing, storing, and displaying clinical information when and where it is needed to improve treatment and to provide aggregated cross-patient data analysis. Now, the systems can manage healthcare data and information in a way that is patient-centered and information-rich. It can also help better manage the patient's health by using capabilities provided by enhanced clinical decision support and customized education materials. Now, electronic health record systems, or EHRS for short, is often used interchangeably with computerized patient record, clinical information system, electronic medical record, and many others. EHRS may be used by all participants in the process of achieving health, including all disciplines of clinicians, family caregivers, and the patient. EHRS provides the components that support clinical and healthcare functions, including business rules, procedures, and so forth by accessing the EHR to write and or read patient data. As a term, EHRS is recognized internationally. The Institute of Medicine, or IOM, has their own definition of EHRS, which includes the following. First, longitudinal collection of electronic health information for and about persons, where health information is defined as information pertaining to the health of an individual or healthcare provided to an individual. Second is the immediate electronic access to person and population level information by authorized and only authorized users. Third, provision of knowledge and decision support that enhances the quality, safety, and efficiency of patient care. And lastly, support of efficient processes for healthcare delivery. Now let's briefly talk about these two main areas involved in EHRS. Now first would be your federal initiatives, which focuses on agencies that provide direct care and those which use a variety of mechanisms to provide leadership toward an interoperable IT-enabled healthcare environment. Now they continue to actively identify and target solutions that lessen the barriers and accelerate the use of your EHRS. Now the second would be your public-private partnerships. Now they include groups newly formed to address issues of electronic connectivity, professional associations that have done so as part of their attempts to serve their membership, and long-established standards development organizations. Now some of these are Connecting for Health, eHealth Initiative, Institute of Medicine, Certification Commission for Health Information Technologies, and of course your Health Level 7. Now these two areas have been making studies, research, or any improvement they could provide so as to help enhance the health information technology. Now you might probably be wondering why we nurses are involved in the information technology advancement of our healthcare delivery system. Now we nurses are responsible for the care coordination and promotion of wellness and are often the patient's primary contact and the final point in healthcare delivery, where medical errors and other unintended actions can be caught and corrected. So basically, we nurses are the ones who are always in contact or always communicating with our patients, and so we get from them the data we input in our system, and of course vice versa. So as the largest human resource in the healthcare, nurses are drivers in organizational planning and process reengineering to improve the healthcare delivery system. Now, I know you have a lot of reasons in mind about why the nurses are pretty much involved in the electronic health record system, and so with that, I'll leave you with a video about electronic health record systems. Thank you and God bless.
Many industries are much more electronically connected than the healthcare system. Many people would argue that the word system really cannot be used.
We have to wait in line to get admitted and go through all this paperwork. And as a mom, you do have the concern of germs, especially with her immune system being so compromised.
When I wanted to find an X-ray, a CT scan, many of the times that scan was locked away in someone's office for the weekend.
We lose 747 of people every day through medical errors.
The cost of healthcare is growing at an unsustainable rate because there's a lot of inefficiency in the system. Everybody realizes that you can't continue with paper and pencils forever. It's not efficient, it doesn't save money. One of the ways that we could change this is by adopting electronic records.
An electronic health record is the compilation of all the data surrounding a patient's care.
In places like UPMC, we're beginning to see the use of electronic medical records in which there's actually valuable data that's usable by the doctor, but more importantly, by the patient.
The UPMC is an integrated delivery network among 20 hospitals in southwestern Pennsylvania.
I think what makes our hospital special is leveraging a lot of the use of technology to make care better for the patients that we're seeing here.
This is our medication administration cart, or computer on wheels, called a COW. If a patient has a question about what their lab work was, we can pull up the results instantly and print them out for them. How are you feeling this morning, Heather? Good. And then once we enter the room, we use what's called our PPID. And this is a scanning system that scans the patient's wristband and then the medication. It verifies that we're giving the correct patient the correct medication.
Heather has some allergies to medicines, and it gives me such a sense of confidence to know that she's getting what she needs. It's always super to double and triple check, and just to know that that's happening, I'm really, really thankful.
We've had a 60% decrease in adverse medication events. So we're never making mistakes with handwriting because we don't have handwriting.
For the nurses to be able to not sit there and take forever with paperwork, that frees up the nurses so much more.
It's more comfortable here. Like, everything's just nicer.
The continuity of the record goes across all 20 of our sites. So if, for instance, you're in a motor vehicle accident remote to Pittsburgh's center hub, by the time you're flown here by the helicopter, the trauma surgeons actually already reviewed their CAT scan to know what the treatment plan is going to be.
Your chart, when it matters, is in radiology when someone needs to not make a mistake and give you the wrong medicine. And it's in the middle of the night, it's in a doctor's call room, and they need to know that I left a note saying you should do this for this patient.
Physicians who are using electronic records are definitely seeing quite a bit of benefit, and it's very efficient. They're doing a lot more in a lot less time.
The fact is that in order for these technologies to help us provide better care, more efficient care, safer care, it has to be fast, stable, and accessible.
With UPMC and throughout the world, we have played a role in terms of helping provide the software, the middleware that allows data to flow.
The potential is enormous for using electronic records to gather data that can be used for research and for tracking what works and what does not work.
What I'm interested in is not just the individual patient with an infection. I want to see what's the ebb and flow of those infections coming in, which you can when you can look at the aggregate data.
The electronic health record is going to allow us to expand and provide best care and least expensive care.
The goals that we are facing in terms of the bigger changes in healthcare really coincide with the movement toward electronic records. If we want to have a more efficient system, then electronic records are a part of that.
I'd give a frank comment to my physician colleagues, and I'd say if they don't evolve, they will become extinct. That the evolution and the cultural adoption has to be there.
If you want to practice safer, if you want to practice smarter, and if you want to do the right thing for the patient, then those are the reasons that you become a physician. And those are the reasons to use this technology.